They're considered essential. Healthcare workers risking their lives on the front lines against COVID-19. But millions of essential workers and their families run another risk: deportation.
They are working out there. We're putting our life in danger to help someone else.
Jonathan Rodas works as an operating room assistant in Maryland. A new study says 1 in 5 essential workers are immigrants, like him, who worry they could lose their right to work in the U.S. at a time when they say they are needed most.
How will you take away something that is helping the community?
The study, released today by pro-immigration group Forward.us, estimates more than 5 million essential workers are undocumented. Others, like Rodas, have temporary protections like DACA, which is being challenged in courts. Rodas has been working at the Greater Baltimore Medical Center helping patients before surgery. He says healthcare is his passion, even during a pandemic.
I'm just telling myself that I'm doing this for a patient. I'm doing this for someone, helping someone else.
Rodas lives with his mother, his brother, and his undocumented stepfather. When the pandemic began, Rodas was most worried about bringing the virus home to his stepfather.
My stepfather does not have any insurance. And what about if he ends up in the hospital and has to be hospitalized? The bill, we don't want to end up with a tremendous bill, because we're not going to be able to pay for it. So it's scary.
But in July, Rodas and his entire household tested positive for COVID-19.
When we end up getting, I was like, what in the world happened? I was like, they trained us for this.
Fortunately, no one in Rodas's family was hospitalized, and they have now all fully recovered from the virus. Today, Rodas is back in the operating room caring for patients.
Not a lot of people want to be doing that because they're scared. But no, immigrants, they're like, no, we want to do this because we want to be part of our community.
Immigrants like Elizabeth Valencia, who cares for dementia residents in a nursing home that experienced a massive COVID-19 outbreak. At one point, she says, she was the only nursing assistant caring for 28 COVID-positive patients.
Every single day we was afraid, at these days. But, we cannot live in, how you leave somebody, you not feed her, you not give it food. It's not possible.
Valencia came to the United States 20 years ago under temporary protections given to Salvadorians after an earthquake devastated the country. She now lives in Maryland with her son and his pregnant girlfriend. The soon-to-be parents are undocumented.
Elizabeth, are you ever worried that they could be deported?
Every day. Every day is... Every day.
And as the Trump administration has threatened to roll back the protections known as TPS that allow Valencia to live and work in the U.S., she has worried about her own livelihood.
Trust me, all these months, every single day, I was worried about lose my TPS because that means I have to back to my country.
And what would life be like for your residents if you didn't come to work?
Oh, miserable, because they depend on us. They depend. If tomorrow they say all immigrants, they cannot enter to work at this unit, all resident in my unit will be alone.
With a vaccine rolling out this week, both Rodas and Valencia are looking forward to the end of the pandemic. But with undocumented family members and looming lawsuits challenging migrant protections, much of their uncertainty will likely remain.
Hey everyone, I'm Allison Morris. You are watching NBC News Now. We are closing out the third day of COVID vaccinations here in the U.S. as a nor'easter threatens vaccine deliveries in our country. More than 70 million people up and down the East Coast are getting ready for that storm. Meanwhile, more hospitals are welcoming their first shipments of Pfizer's COVID vaccine today. Thousands of healthcare workers getting their shots. Assistant Secretary of Health Admiral Brett Giroir says this is a great start, but we can't ease up just yet.
We're immunizing for impact now. We will start seeing that almost immediately. But herd immunity, when the pandemic really ends and goes away, that's not until the late spring, early summer.
And a new warning from the CDC. The U.S. could see 60,000 more deaths by January. So far, more than 305,000 Americans have died during this pandemic, and more than 16.8 million people have tested positive for the virus. NBC News Now correspondent Dasha Burns joining me from Sanford Medical Center, that's in Sioux Falls, South Dakota. Dasha, it is the first full day of vaccinations there. Tell us, how many people are getting a shot today? How many doses will South Dakota get in this first round?
Allison, it has been a big day here so far. There's still several more hours of vaccinations left. They started at 7 a.m. Central Time. They're going until 7 p.m. And let me walk you through this process here. This is where everyone checks in. They're checking in, but they're also making a second appointment because remember, this is a vaccine that requires 2 doses. Then they're sent to the actual rooms where they'll be getting the vaccine. There are 4 exam rooms. Patients can come through every 5 minutes. So 4 people vaccinated every 5 minutes. And I think we're about to see a vaccination happen right here in the moment, live just for you, Allison. We have Shelby here who is vaccinating Tom. Tom, how you feeling?
Great.
Feeling good? Let's see. All right. Brave soul, vaccinated on live TV. How'd it go?
It went great.
How are you feeling in this moment right now?
Really, really good. It's very exciting to have vaccine out and that we're now starting to administer it.
And Tom is an anesthesiologist here. Tom, thank you so much. Yep. When they wrap up in there, Allison, then it's time to walk out to the waiting area where, remember, this is also a vaccine that requires that 15 minutes of monitoring just to ensure that there are no side effects. So that's what this space is all about. We've got all these people over here who have been vaccinated. How are you guys feeling? You all got vaccinations. Feeling good? And some folks over here, how are we feeling? I got a lot of thumbs up here, Allison. All day today we've been doing this, and I got to tell you, the enthusiasm, the hope, the light in people's eyes is just resounding. This is a big, big day here in Sioux Falls. Allison?
Yeah, Dasha, from what we can see there, it looks like things are going pretty well. I know the last time you were in South Dakota, there were some current concerns about distributing the vaccine. How's it going so far? Like I said, it seems like it's going pretty well, but what aren't we seeing behind the scenes? Are they running into some issues?
It's going well here. I mean, the really big test is going to be once this really gets rolled out to the broader public and they have to get the vaccine to some of those more remote areas. But that's going to start happening even in just the next week or so, Allison, as they're trying to vaccinate healthcare workers in some of those more rural clinics. So that's where we're going to start to really see if that distribution system they have in place, how well it's working. But from what I've been hearing here, they are ready to go. Their couriers are amped up. They want to get this vaccine out to as many people as they can. Allison?
Dasha, the virus has killed 1 in every 1,000 South Dakotans. You've been talking to frontline workers there. What have they been telling you?
I want to introduce you to Terry Peterson-Henry. She's a palliative care doctor here, and she has an incredible story, Allison, because palliative care doctors, they are end-of-life care. They are caring for patients and for families who are in some of the toughest places at this time. She recently had a family member of hers pass just around the time that the vaccine became available. Her brother-in-law, who was also a practicing physician, he was caring for patients himself up until some of those very last moments. And she got vaccinated today, and it was a bittersweet moment for her. And I want you to hear about what that moment meant. Take a listen.
It's wonderful. It's the beginning of the end of this pandemic. It's the beginning of doing something to reverse this so that we can have life return to where it'll be a new normal, but it'll certainly be much better than now when we're all having to be masked and isolated, and we can't gather for family gatherings, we can't gather for weddings and funerals and holidays. And this is the beginning to be able to restore normalcy.
South Dakota is also one of the first states where nursing home employees are getting vaccinated. I spoke to a couple of those folks today as well, and Allison, nursing homes have been hit so hard. The staff there has seen so much tragedy, and they've been watching over these folks who are alone right now, who can't have their grandkids visit. And they were very emotional when I talked to them as well, just seeing that light at the end of the tunnel for both themselves and for the residents that they care for.
All right, Dasha, thank you so much for taking us on a tour, showing us around, letting us know what's going on there in South Dakota. It sounds like it's a very good day. I know there's a long way to go, but a very good day, a very good start. Thank you.
Thank you so much.
Frontline workers at UCLA Health got their first COVID-19 vaccines today, while Los Angeles County recorded its largest daily death toll yet, 131 people. NBC News correspondent Jacob Soboroff has the latest on the coronavirus from Los Angeles.
Hey, Allison, it is both a hopeful but also extremely bleak day here in Los Angeles County, of course, the largest county in the nation with a population of 12 million people. Here at UCLA, the first vaccines started earlier today, just a couple of hours ago, as a matter of fact, and they expect around 450 people to be vaccinated over the course of the day. Today, thousands of doses are here in the hospital right now, and all 30,000 people who work here at UCLA Health are expected to be vaccinated over the course of the next 6 weeks. But those vaccinations will not stop what is really, I think you can only describe it as an epic surge of coronavirus positive diagnoses and deaths here in Los Angeles County. Today, for the first time ever, they have 114 COVID patients at this hospital alone. That is an all-time high over any point in the entire pandemic. 4,600 people are hospitalized throughout the county of Los Angeles with COVID-19. And that is why you hear the governor of the state of California say 5,000 body bags. 5,000 body bags are being brought into this state to deal with excess mortality here in the state of California due to the coronavirus. Southern California alone has received around 300,000 doses of the vaccine in this first wave, but it is too late to stop the death, to stop the suffering that the residents here are enduring. It's why I have to say people are so positive, though, inside the hospital today to know that that help, that medical help is on the way. They want people to know, which is why they televised this, opened their doors to cameras, that it is safe, that it is effective. And of course, all communities across this very diverse county of Los Angeles, a majority minority county, so to speak, should receive that vaccine, should take the vaccine, and tell their friends and their loved ones to do it as well. So again, it's that juxtaposition of hope, but also a lot of hurt here in Los Angeles, Allison.
Thousands of frontline workers are getting vaccinated as we speak, but it will take millions of doses to cover all of them. Tomorrow, an FDA advisory panel is considering Moderna's vaccine candidate. Dr. Fauci, pretty optimistic ahead of that meeting.
The speed is a reflection of the extraordinary scientific advances in vaccine platform technology that allowed us to get here quickly, and also the enormous investment that has been made in developing and producing doses of vaccine so that they're ready when the FDA makes that decision. That's exactly what happened with Pfizer, and that is what is going to happen with Moderna.
Emergency medicine physician Dr. Anand Swaminathan joins me now. Dr. Swaminathan, we just heard Dr. Fauci talking about how quickly these vaccines were developed and approved. It is no doubt a huge scientific accomplishment, but that speed is also making some people nervous. What safety data do you want to see from Moderna tomorrow?
We're already seeing some of that safety data, very similar to what we saw with the Pfizer vaccine. There's a lot of minor adverse events. I think everyone who gets this should expect they're going to have a minor adverse effect. Fatigue, maybe headache, maybe some body aches. Those are pretty minor things in comparison to getting COVID, especially what we have seen in the emergency department, what we've seen in the ICUs and in the hospital. So we want to see the same. We want to see the same for the Moderna data. What we've got from the FDA so far echoes what we saw from Pfizer. Bell's palsy is something that people have talked about. This is a minor nerve paralysis. It's usually fleeting. It goes away. And we haven't seen that in the Moderna data. So that's going to be an interesting thing to see. And then the allergic reactions, which is getting a lot of press recently and something we have to pay attention to. So we'd like to see those. But overall, the serious adverse events seem extremely low for both vaccines.
Can you walk us through, I know these vaccines are similar in many ways, but can you walk us through some of the major differences between the Pfizer and the Moderna vaccines?
This is a question that everyone's asking, and they are very similar. They're both mRNA vaccines. They both have similar efficacy in that 95% range. The Moderna vaccine does have some bad parts and some good parts in comparison. So one of the bad things is it has to be given 4 weeks apart. So 2 doses, 4 weeks apart. Pfizer's 2 doses, 3 weeks apart. That 1 week difference, not a huge amount of time, but there's a difference there. One of the big differences is the storage process. So the Pfizer vaccine, we know, has to be stored between -60 and -80 degrees centigrade. It can be kept in refrigeration, but only for a couple of days. And that makes distribution a little bit more difficult. The Moderna vaccine is going to be stored at -20 degrees Celsius, which is still pretty cold, but it's better than -60 to -80. Once it's thawed, it can be kept in a refrigerator for 30 days, up to 30 days. That's huge. And even at room temperature for 12 hours. All of those things is going to help with distribution. Now, the Pfizer vaccine may be just as stable, but it wasn't studied at those temperatures. So the Moderna vaccine does give us a little bit more flexibility with distribution because of how it's stored. But otherwise, these are very similar vaccines.
The New York Times is reporting a healthcare worker in Alaska had a serious allergic reaction after getting the Pfizer vaccine. And according to this report, the person didn't have a history of drug allergies. Any concerns here? Anything you'll be watching for as more people get vaccinated?
To a certain degree, this was expected. When you roll out something at this level, this many people getting it, we expect to have some severe adverse reactions. It sounds like this particular healthcare worker had an anaphylactic reaction, responded well to our first-line medications, epinephrine, which is great that they responded well, but we expected this to happen. It seems, though, that they're rare. When you think about how many people already in the last couple of days have been getting vaccinated, we just have this one case. But what this really stresses is the importance of getting that post-release data and post-release monitoring to see what the safety is going to be like. When you roll something out from a study of 40,000 and then giving it to millions of people, we're going to have to keep track of that safety data. But I think overall what we're seeing is that this is very safe. People should feel reassured. And the guidelines that are in place to watch people for about 15 minutes after they get the shot to see if they have that adverse reaction seems to be panning out well. So I think that safety measure is really necessary. We have to have it there. But overall, we're seeing a very rare adverse side effect profile, the serious adverse effects.
We know that elderly people are more likely to get very sick and to die from COVID-19, but research out from the Journal of the American Medical Association found that young people ages 25 to 44 are in fact dying from COVID, and that July might have been the deadliest month for younger Americans in modern American history. That is pretty scary. What is your message for younger Americans right now?
This was a really important publication. You can see one of the names on that, Jeremy Fauci, who's I know is all over media. He did some great work here, and so has Dr. Rochelle Walensky, who's going to be our new CDC director. This is really important data. We knew this in healthcare. The healthcare workers have seen this. We've seen young people without any medical problems dying from this disease, but it's been hard to get that message across. And I think it's easy as a young person to feel kind of invulnerable, that you don't really have to worry about this, but we do. We need to worry about it. Young people need to be concerned. We saw 12,000 deaths in excess between March and July. That's a huge number, 12,000 deaths in excess. And the only thing that's different this year from prior years is COVID. So we know that that's where these excess deaths are coming from. So what does it mean? It means that young people need to be just as safe, which means masking, physical distancing. Don't think you're invulnerable. And the hard part, of course, is a lot of people in that age group are essential workers. They can't stay out of work, but you got to mask. You got to keep that distance. And remember, I think that these small social gatherings, unmasked dining, this is like the new super spreader event. We have to be really careful to avoid that. And I'm not blaming the 25 to 44-year-olds saying that they're doing more of this. We just have to be extra careful about it.
Dr. Swaminathan, thank you so much for the great advice and for coming back on to see us on News Now. I hope we see you again soon.
Thanks, Allison. See you soon.
Many minority communities are still skeptical about getting the COVID vaccine, even as they watch frontline workers get shots in the arm. NBC News correspondent Valerie Castro is joining me now from El Paso, Texas. Valerie, for the Latino community, this pandemic has been absolutely devastating. So why are some Hispanics there in El Paso still scared to get vaccinated?
Well, Allison, I think the key word is fear, and I don't think that is unique to the Hispanic community, right? Everyone is afraid of the unknown. What is unique here is that in total, El Paso has seen 1,300 deaths, and the city and county says that 90% of those deaths have been within the Hispanic community. A devastating number if you take that into account. The hospital here received the first shipment of vaccines yesterday. We were there as 5 frontline workers got their vaccines. A nurse was the very first one to go. Her name was Crystal Molina, and she says she wanted to be a good example. She wanted to put it out there that it is safe and that it is backed by science. Allison?
Valerie, so what are the state and the city doing to try to repair that distrust, to try to get people on board, or just to try to encourage them to get vaccinated because they know it's so important?
Allison, it's all about trust. The county administrator here, Judge Ricardo Samaniego, says the Hispanic community is really going to be looking to leaders that they can trust, those voices that they can trust. So he says it's so important that nurses like Crystal Molina step up to the front and be that example and lead by example. Allison?
All right, Valerie Castro in El Paso, Texas, thank you so much.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.